Currently, it is estimated half the population of the United States is diabetic or pre-diabetic. Those stats are staggering, and well, they're not slowing down, even with almost 50 different diabetes medications currently on the market. According to AARP, 65-year-olds in this country are taking an average of 5 different medications each day, with the average for all type 2 diabetics being 9 per day. Here with us are Drs. Tom and Stephanie Chaney of Living Health Integrative Medicine to share with us a different approach to diabetes, one that's actually helping patients reverse their type 2 diabetes. Welcome back. I want to go back to that number for a second. Some people are taking 9 different diabetic medications a day.
That's the average.
Yeah.
Wow.
And in most of these medications, they're just geared towards treating the symptom and just trying to manage the disease and the progression of the disease. And we know that if you're just managing symptoms, it's going to progress and you're going to see complications like heart attack and stroke, amputations, kidney failure. And so what we do is we take a totally different approach, and we don't treat each individual in a cookie cutter model. We want to actually look for the underlying root causes of why the sugars are high. And then over time, we don't just manage it, we're actually able to reverse it. And then patients start to reduce and eliminate medications. They're actually able to control this disease and not depend on a pill.
Well, they keep prescribing. I would be afraid to take so many at one time. You don't know how they're going to interact with each other.
The record in our office is 23 prescriptions that one person was taking.
Yeah.
A day?
A day.
How do you even do that?
I don't know.
Right.
That's crazy. I mean, those numbers are just, I would be so scared just to don't know what I'm putting in my body. But Dr. Tom, you were saying, you said the word causes. And we talk a lot of, you mentioned managing, but the causes of diabetes, we hear the pancreas all the time.
Yeah.
It's not just about the pancreas?
No. In fact, if you have type 2 diabetes, or that's what you've been diagnosed with, it rarely is a pancreas problem, especially in the beginning. And the beginning could be decades of dealing with diabetes. What we find is that people are told it's their pancreas or their pancreas isn't working very well, but we test people's pancreas function and it's overworking. The pancreas is actually overfunctioning, trying to produce excessive amounts of insulin to deal with all this systemic sugar overload. And so what we have to do is we do very individualized testing, comprehensive novel testing to try to figure out what are all the other reasons why the sugars are high, because it's a systemic issue. It's cellular dysfunction, insulin resistance, it's hormone imbalance, it's food intolerances, immune reactivity, stress, lack of sleep, environmental factors, different, all these different things add up. It's not just, oh, I'm eating too many jelly beans and my pancreas is dying. In fact, it's rarely the case. And so what we do is we are able to, through all this testing for each individual person, come up with why that person has their type 2 diabetes, and it's different from person to person. And then we create an individualized approach for each person to help them reduce and reverse their diabetes.
And it's got to be so frustrating for patients that are doing what the doctor's telling them, is exercise is cutting down the sugar, and either the diabetes is getting worse or it's just not getting any better. So Dr. Tom, you said the word reversal. So what does that mean? What is reversing type 2 diabetes?
Well, once we treat the underlying root causes, like Dr. Steph said, then the body gets healthier. We're not just pushing a number down with medication, we're actually enhancing function and removing the dysfunction and actually seeing patients reduce and eliminate medications. They don't need to just push these numbers down anymore because we've actually improved their health. We see them have more energy, they're losing weight, they're feeling better, they're functioning better, they're sleeping better. All these different things that we see just by enhancing function and not just suppressing a number with a pill.
But we do track the number, because we have to be able to know when that person can have their medications eliminated and reversed. And how do you know when the diabetes is reversed if you're not tracking the number? So the actual number for diabetes that we track is called hemoglobin A1C. It's a percentage of red blood cells that are destroyed in this process of being damaged by blood sugar. And the normal range that we look for is 5.7 or below. According to the ADA, that's non-diabetic.
Right.
5.7 to 6.4 is pre-diabetic, and over 6.4 is considered full-blown diabetes, and you're definitely being put on medication. So we're tracking that number, but we're just tracking that number as a success of where our protocols are working with just getting the body functioning better underneath all of that.
So Dr. Tom, how does somebody know and get more information from you guys to see if this could be something that's good for them?
Yeah, to see if they're a good candidate for our program, the first step would be to come to our seminar. So we have a couple seminars coming up, one on this Saturday and then one next Wednesday. Attend the free seminar, get more information. We expand on what we talked about today. Because most patients have a lot of questions like, why isn't my doctor doing this? And you know, there's a lot of myths out there that we cover in the seminar. So come to the seminar and then we'll get into more details, and that's the first step.
Okay, and you guys have a really incredible goal that you're after as a partnership here.
That's right. So we want to help at least 1 million patients reverse this disease, which is one of the reasons why we wrote this book, Defeat Diabetes. And we're going to give away free copies of this book for everyone in attendance at these upcoming seminars.
Awesome. Doctors Tom and Steph, thank you so very much for being here and helping us all be our healthiest selves. The first step to reversing your type 2 diabetes or pre-diabetes is to attend the next Diabetes Solution Seminar, Saturday in Columbia or next Wednesday in Annapolis. Now, to see if you qualify for the seminar, please call 888-514-4771 or visit diabetesreversalseminar.com. If you qualify, you will receive an invitation to one of the upcoming seminars and the free book, Defeat Diabetes. Don't delay, make that call right now, 888-514-4771 or visit diabetesreversalseminar.com. This segment is sponsored by Living Health Integrative Medicine.